It's Nurses Month, and we're celebrating big at Nurse.org. We're not just doing one giveaway, we're giving away hundreds of prizes all month long. That's right, you can win instantly and enter every single day. We're talking Amazon, Visa, Walmart, Starbucks gift cards, plus shoes, scrubs, and so much more from brands nurses actually love. Don't miss out. Head to nurse.org/win to enter now through May 31st. And make sure you're following at nurse.org on Instagram for even more chances to win all month long.
Welcome to Club Nurse. I'm Colton Lord, your host. By you being here today, it shows me that you are someone who wants to learn, grow, laugh, connect, and just let your emotions flow. We are here to share real stories and hear real life experiences from real people. You are not alone in this, and Club Nurse is here to show you that. Don't forget to follow the show and share today's episode with someone you love. Now, let's dive into today's conversation. All right, everybody, welcome back to the Club Nurse podcast. My name is Colton Lord, your host, and today we are talking to a very exciting guest who I love, exactly like what you're doing. This is amazing. Emari is a Georgia nurse who has created a YouTube character, Nurse Dolly, to teach kids about health, hygiene, and doctor visits. The mini med school series uses songs, stuffed animals, toys, cars, medical tools, and storytelling to make healthcare less scary for children. So yes, let's introduce Emari. How are you today?
I'm doing well, Colton. How are you?
Doing okay, hanging in there. I'm super excited to have you on today and kind of talk about how Nurse Dolly came about and where this inspiration came from. So let's kind of start there. Like, where did you get this idea? Like, where was this born? Were you wanting to create content, or was this something that was like a pain point in your own life where you were like, something needs to change? Like, how was Nurse Dolly born?
So as a mom to a toddler and a preschooler, my kids spend a lot of time on YouTube learning. There's a lot of great educational programs on there that teaches them about their alphabets, their shapes, the planets. There's a lot of great content on YouTube, but I noticed that there was a gap in health education. So one day I was literally just driving and I was trying to figure out how I was going to make an impact beyond bedside nursing. I believe my kids were in the car with me, and I was like, I'm going to create a YouTube channel that teaches kids, that promotes health and wellness. That's specifically like what I'm going to be talking about on the show. So that's how I came up with Mini Med School with Nurse Dolly. And here we are today.
Nice. And when did this start?
So this started the idea came to me in June 2025, and my first video was released July 2025.
And had you made content before? Like, did you know how to make videos, or was it just like, let's just learn as we go?
No, I just learned, me, Google, and ChatGPT. We learned along the way, and that's how I gathered all the information and just learning process.
Yeah, that's typically how it goes. I think it's important for people, I mean, all people, but any nurses out there who have ideas or want to create things, or like I said, anybody really, is I think that a lot of people have this like misconception that we are like people who create content or like take chances to start a business, like already have all these tools and know what to do. And it's like, really, from what I've learned, is most people have no idea what the hell they're doing until they start doing it, right? And then they start, as they get going, and they learn more things. And I think you'd be surprised at how quickly you start picking up skills and just learning how different like industries work. But I was watching some of your YouTube videos, and I was curious, is this like, are you coming up with like all these, like, how are you coming up with all these like songs? Is this all, do you have like a team that kind of helps you? I'm very curious about that.
Yeah, so I've built a little team. I primarily handle like the songwriting and the topics, along with suggestions from parents on what they want, what they want to see. But for the most part, it's me. I have a videographer that captures my raw footage, and I have an editing team, and we just collaborate and get it done.
Yeah, I love it. I mean, it's catchy, and I think I don't have kids, but I think for kids to make things, going to the doctor is scary, getting shots is scary. So anything that you can do to make it a little bit less scary and normalized, where like the next time they go, if they've watched your videos, they can refer back to that and be like, okay, I remember this, or I remember why I have to do this. So what is your, like, what's your mission with this? What is your goal? Like, what are you exactly trying to do with this mini med school series?
Yeah, so I'm wanting kids to feel more confident about their bodies, and as you state, like feeling more confident with going to the doctors. I've actually had parents already tell me that, doctor visits have improved since, showing their kids Nurse Dolly. So that's one of the goals. I want kids to just know how amazing their body is as well and all the amazing things that it can do, but also for them to learn how, I feel like in their early years when they're 4 and 5, if you set the foundation of health and wellness in a young age, they'll grow up to be healthy adults. So I like to say healthy kids are going to grow into healthy adults, right? So that's one thing. Another thing is creating the positive representation for kids and knowing that they can become nurses, they can become doctors, they can become healthcare professionals. So those are two of the main, just being confident and knowing how amazing their body is and inspiring the next generation of nurses and doctors, because we always need nurses, right?
Oh my gosh, yes. We need them to start. We need them to get that seed planted now when they're like 5, that we need help. They need to understand the assignment. Do your kids watch? How many kids did you say you have? 2?
I have 2 boys. They're 2 and 4. And yes, they do watch Mini Med School. They love the songs specifically, but they do watch the episodes. And my older son, who's 4, is already calling himself Dr. EJ, and even his little brother is now calling him Dr. EJ. So
that's so sweet. That I think that is what is, again, important, is like kind of like seeing these things, feeling comfortable. If kids are going to be on YouTube or they're going to be scrolling or watching things, at least it's something that's like educational and making them more comfortable. So you said you've gotten some feedback from parents. What are like the feedback that you're getting? What are they feeling is helping their kids the most by watching?
So I believe that they're saying that the songs, the kids are loving the songs and, dancing to them. I've gotten a lot of videos of the kids dancing to the music, but also the interactiveness of it, them being able to, respond and answer the questions appropriately. They've been appreciating that. So that's
okay. Yeah. Yeah, I love that. And you use, I've seen that you use like stuffed animals and things like that to kind of help make is that just to help make the kids more comfortable, just to see like, okay, like, oh, the teddy bear is having this done. So, it's safe for me to have that done.
Right. And kids have stuffed animals. I wanted to use things that they're accessible to. So most kids have stuffed animals. So I want them to be able to role play at home with items that they have. So I like to incorporate it, and it makes it more fun when they, when you personify a teddy bear or a monster truck who needs first aid, and now they can do it at home with their monster trucks. So
yeah, it's probably fun for you. I mean, even your your inner child gets to like play a little bit, even though you're making like this educational video. I wonder like how this would be for, I don't know how, again, I don't have kids, so I don't really know how like school curriculums work these days. But I'm curious, if this is something, if I'm sure that teachers do show their students maybe like YouTube videos. I'm sure. Again, I don't know. But is this something that you're hoping that maybe teachers will be able to like, kind of put into their curriculum as well and show the kids like on certain days?
Absolutely. I've actually had teachers send me footage of their kids watching my videos in class. And tomorrow I'm going to actually be visiting a school to go over some concepts, nutrition, and we're going to do a teddy bear checkup. We're going to talk about, emotional health and their feelings. So one of my main goals is to start incorporating Mini Med School with Nurse Dolly in schools, a part of their curriculum, health education, wellness education. Very important topics. So yeah, I'm grateful for the teachers that have been supporting thus far and looking forward to expanding more into the school system.
That's awesome. I mean, when I think back to when I was, school age, I don't know that we had anything. I'm trying to think of like, where did I learn, these like about the body, like as I was growing up. I don't know that I had that. Truly, I could remember like a Hannah Montana clip where she was like getting out of the home, but I don't know that we had anything. And if we did, obviously it wasn't very memorable. So I like this. I think it brings the play into it. It makes the kids more comfortable. Catchy songs to where like they're able to like, if they're singing those songs, like they're like putting that in their brain to remember later. So yeah, I love that. Are you still working at the bedside? Is this your full-time job or?
So yes, I still work bedside nursing full-time currently while I manage growing Mini Med School with Nurse Dolly.
Okay. So for, anyone else, say it again?
No, so I've been balancing both working full-time and Mini Med School.
And how's that? So for any nurse who is out there listening, who again is like thinking about, creating some other venture or, making content or starting a business, like how are you doing that? Do you find like, what are your biggest barriers to, trying to balance it all? How does that work for you?
So it's been overwhelming because I'm balancing being a mom in real life. I'm balancing being a wife in real life. I'm balancing being a nurse, and it's been overwhelming. I would say a lot of it just goes back to time management. Luckily for nurses, we work 3 days a week. So those 4 extra days, we have to make it count. 9 times out of 10 on my extra days while my kids are away at school, I'm trying to get my Nurse Dolly things done.
Recorded.
So balancing management, staying organized. I'm always writing some type of notes on what I need to do for the day. I'm a very organized person, so I managed to get.
Are you an ICU nurse?
I'm an emergency medicine. No, I'm not. Right, I'm in the middle of chaos, but
okay.
I'm organized.
Okay, I mean that's good. I think it's a good trait to have. I think I've done both. I've done ER and inpatient nursing. I think an organized ER nurse is like that's perfect actually, because you don't find many. A lot of our brains are very scattered, and we're just like kind of like okay, like all over the place. So you work in the ER. Do you work in like with pediatric kids as well, or is it adults?
I work in an adult ER. We see pediatrics from time to time, but not really. It's mainly adults.
Okay. I was wondering if like kids were coming in and be like, oh my God, Nurse Dolly, my actual nurse.
No,
No,
unfortunately not peds.
Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today.
So where do you see this going for you? Like what is your ultimate goal? I know we talked about trying to get into schools, kind of getting into curriculums. Is it just like you're just trying to take this day by day and see what's going to happen next, or do you have like are you wanting to have like kids books made? Like what is your ultimate goal with this?
So right now, I'm focusing on just providing the accessible videos for the kids, but for sure, looking forward to expanding into children's book. I already started to write my first children's book that I hope to release soon.
Oh, awesome.
I want to provide free educational resources for educators, for parents that are homeschooling their children, or just parents in general that can be accessible through my website. I would love to expand into toys. I would love to expand into just overall great educational learning resources.
Gotcha. Yeah, you got a whole vision there.
That are healthy for kids. I have toothpastes and toothbrush that are healthy for kids, vitamins. There's so many lanes I feel like Nurse Dolly can fit into. So hopefully with time and with growth that we get there.
Yeah, I think what you said earlier really is kind of the key to what you're doing. From what I'm noticing anyway, is really setting that foundation. Because even if you have this foundation of health and knowledge and understanding your body, even if you veer off and you have a couple years of being unhealthy, or you have these habits that are that you want to kick, like if you have that foundation of knowledge, I feel like it's at least easier to kind of get yourself back on track versus if you have this like huge gap in kind of in knowledge. And then I guess your kids aren't really in like school age yet, but I do wonder. Maybe you have the answer to this. Like, what is current? I mean, you're in the South, correct?
Right.
Yes. Like, what is the current curriculum with health? Like, what are these schools teaching? Is it just like a very basic understanding? Like, what are they teaching kids? Do you know?
So I honestly don't know. I'm not sure if my older son is in school. I'm not sure if they have a health curriculum. I know growing up as a child, I did have physical education and health classes, but it wasn't really anything that honestly I can say really stuck with me. I'm not sure if it's maybe how they were teaching it that wasn't engaging enough, at the time. It wasn't songs or interactive videos and questions and answers and stuffed animals that are age appropriate when you're, wanting to keep the attention of a 4-year-old or a 5-year-old or a 6-year-old, But I can say that I remember going to health class and having PE and health. So
okay, I guess I did too.
Yeah.
So how do people find, if they want to find your resources? Like, how do they find you?
So I'm currently on YouTube at Nurse Dolly. All of my videos are on there. I have a website where you can access my YouTube through the website. But the future educational resources that I plan to have, which will include like, worksheets for educators, games that can be all printed out. Those will be found at nursedolly.com in the future.
Okay. And what is the typical like age range that your content is mostly targeting right now? Like, is it, yeah.
Yeah, so I'd like to say 2 to 8, but I feel like the sweet spot is like 3 to 6 because at two, they're kind of just vibing to the music. Yeah. They're like, yeah, we like it. We see the animals. We see, but 3, I feel like they can kind of grasp the concept because I've seen it with my son where he comes back and he's like, yeah, Mom, my heart pumps blood and the lungs help me breathe. So I feel like they can grasp the concept at 3 to 6. I feel like 6 to 8, they're kind of like, yeah, she's giving, I don't know. I like to say 2 to 8, but the sweet spot being 3 to 6.
Okay. That's helpful. And and this, maybe you don't have the answer to this question, but do you like have plans to maybe, like broaden that to because the reason I'm asking is because I like I said, I was even watching some of them and I feel like for, even for parents who maybe don't have I think a lot of adults don't have a very high understanding of just health and how our bodies work. I mean, unless you've gone to school and have been taught all these things, it's kind of, there's a gap, which is why you're doing this. And so I could see how even for parents, if their kids are watching this, how that would be even educational for them. So yeah, I'm curious, what would be your thoughts? Like how would you gear this towards even maybe you would be more able to answer this as your kids grow because you kind of can see, oh, this is where their gaps kind of are. But do you have any plans for that?
So I've actually, just to comment on what you said, I've actually had parents mention as well, like my kids are learning, but I'm also learning as well. So keep the videos coming. I have nursing students like, hold on, I need to use this while studying for nursing classes. Right. So I have been getting that feedback. Okay. I've also had a parent mention one time, that they would love to see a video, of me speaking about the women's menstrual cycle for their preteen. And although I was kind of like, well, my target audience is 2 to 8, I'm not sure if that's a topic, but it did make me think like maybe I can do like Nurse Dolly for teens, where it's a little bit more geared to teenagers or preteens, where I can talk about topics like, their menstrual cycle and things like that. So I've considered it. I haven't got all the way there yet. Right now, I'm just kind of focusing on, this target audience. But in the future, that would be great. Nurse Dolly for teens. Yeah. And that's the middle schools and the high schools and incorporate it into those health education classes. So.
Yeah, and that's great. And like I said, you're already doing amazing. I'm not trying to be like, you need to do more. Like, you really are doing amazing. It just doesn't, I'm just curious. And I think when like I said, I was thinking back to my own health education. And I do remember in high school, also having a little bit of some sex education, but it was very just almost awkward and just this is so weird. And then I remember junior high, they put all the boys in one room, all the girls in one room, and kind of taught you a little bit about puberty and things to expect. But it was just very awkward. It wasn't these, where your videos are very normalizing and interactive in the songs. And I think that's, why you're probably having parents giving good feedback too, because like I mentioned earlier with the Hannah Montana dance, when you hear, we remember songs, we remember those kinds of things. And even if we're not, kids that are 2 to 8 years old, we still just kind of learn that way. So yeah, that's why I was asking.
Yep. That was a great question. Yes. In the near future, hopefully as we grow, and we'll grow into the next phase.
We're gonna be seeing Nurse Dolly in the future teaching nursing students. It's gonna be a whole thing.
Yes. There's actually a nurse that kept me going during nursing school. What was her name? Nurse RN. I'm sure you know her. I don't know. I can't remember her name. She kept me going through nursing school with her resource. So maybe
that's the thing is some, there's just there's certain things people learn differently. And I think the more kind of catchphrases you can have, or the songs, or just these little things that help you remember, it's helping you remember it and it's helping you learn it. So I think it's really amazing. Is there anything else that we didn't talk about that you want to make sure we highlight? I know we talked about how people can find you, how they can subscribe to you. do you have like a cadence? Like, are you releasing one video a week for kids to watch? Is it kind of just like as you can? Like, what's your kind of cadence with YouTube?
Well, right now I'm working on the My Body is Amazing series. We're actually finishing that up. I have 2 more videos to drop from that. It's a 6-part series. We started at the heart, then we went over to the lungs and the brain, and then muscle and bones. And then next I'm going to be dropping the kidney video this weekend, and then the stomach and the intestines to follow. So basically it's just a 6-part series that teaches them how amazing their body is, and the amazing things it can do, starting with the heart and the lungs, and songs to go with each organ. And yeah.
All right. It's amazing. I love it. Well, thank you so much, Emari. Again, I think you're doing really amazing work, and you're starting with the youth who needs to be, who needs this information, and I think setting that foundation, which is so awesome. I always applaud nurses who see any kind of gap in healthcare, or a place that they feel like they can make a difference, and I think you're really making a difference for people, and especially kids who I think need it the most. So thank you so much for everything that you're doing, and I really wish you continued success. I think that your Nurse Dolly series, I think, is just going to keep going and keep getting bigger. So congratulations on that.
Thank you so much, Colton. Thank you so much for this opportunity and for having me. And Happy Nurses Week.
Happy Nurses Week. That is right. All right.
From the bottom of my heart, I wanted to thank you for being here at Club Nurse. I hope you gained something valuable from today's episode. And if you did, remember to share this episode with someone that you love. Follow me on socials at Nurse Daddies or Colton Lord 17, and be sure to follow Nurse.org to stay informed with all of the hottest healthcare topics. Until next time, take care of yourself the way you take care of everyone else. Love ya. Bye.